and perform hand hygiene. We're going to take our wrap kit. We can touch this part right now because this is the shiny side, and the shiny side is going to go on your surrounding surfaces. Remember, shiny, go on surrounding surfaces. It's not sterile, so we can touch this. So we're going to move this and we're going to orient it toward the insertion site. So it's going to go on the bed and in between the patient's legs. Now we're going to open our CSR wrap. So you have to do this in a specific way because we don't want to reach over our kit with our hand, which could contaminate the sterile field. So what we're going to do is we're going to peel this to open it, that part off, and we are going to take this top tab off and pull it this way away from us. You have 1 inch on this dull side that is considered non-sterile, so it's like a 1-inch border that you could touch, or you could just grab the shiny side and pull. It's whatever you prefer. We'll pull that. Then we're going to do our side tabs. So remember, you have 1 inch, pull like that, and then we're going to do the inside one, pull it like that. Next, what we're going to do is we're going to don the sterile gloves. Now, you never want to turn your back on this whole sterile field because if you do, you're going to have to start over. Once the sterile gloves are on, you can't touch anything outside of the kit. You can only touch things that are inside the kit because everything is sterile. So we're going to don these sterile gloves outside the sterile field. So now let's open up our gloves. Turning the package around, and always read the little words on the packaging to help you orient it. We're going to take the tabs, stick our hands underneath the tabs, and pull it out. You have about a 1 to 2 inch border to work with, so that paper folds out nice and neat so you can get in there to those gloves. I'm going to glove my dominant hand, so I'm going to take my non-dominant, grab this cuff, and I'm going to slide it over like so. Okay, this is now sterile. We cannot touch anything outside of our sterile field. And then I'm going to go under this cuff right here to glove my dominant hand. Okay, now we're sterile. Now we're going to drape the patient, and we're going to be placing 2 different pads. The first pad we're going to place is called the under pad. And the reason we're placing all of these pads is because we want to extend our sterile field. So we are going to get the under pad. It should be the top pad, and we're just going to grab it here. I want you to see both of these sides. We have a shiny side and we have a dull side. Remember, the shiny side is the side that's going to go on the surrounding surfaces, so it's going to go down. So we're going to place this under the patient's bottom. And the key with this is you got to be careful because whenever you go to place this under the patient's bottom, you don't want to contaminate your sterile gloves. If so, you'll have to start all over. So you sort of want to grab it on this dull side in here, and then this is where your assistant comes in handy. They're going to help the patient lift their bottom, and we're just going to place it and let it fall and go underneath the patient like so. Then we're going to take our fenestrated drape and put it over the patient's genital. It's going to have a hole that gives us an area to work. So we're going to grab this and let this unfold itself, and then we're going to take the shiny side, put it on the patient, and again, being careful as we drape. So we're just going to put it over the patient like this. Now we're going to set up our kit, and this kit is really cool because it labels every step for us. So here we have our Foley with the drainage bag. We have the securement device, the stat lock device that we're going to be applying later. So the very first thing that we need to do is we need to open the iodine. So we're going to open this iodine and we are going to put it on these swabs right here. Step 2 is pour on the swabs. So tear here. And then we're going to just put it on our swabs right here because this is what's going to be used to clean our labia. And we're going to discard this. Then what we're going to do is we're going to attach the water syringe. So we're going to just connect it to this port here. We no longer test the balloon prior to insertion because doing that, they have found, changes the shape of that balloon prior to inserting it up through the urethra. And when we change the shape, it could damage the urethra, which could cause a urinary tract infection, and we don't want to do that. So here's our water syringe. And this Foley that we are dealing with, it tells us it's a 14 French and to inflate with 10 ml of water. You always want to pay attention to that because that's really important whenever you go to remove it. So this is the port that we're going to be instilling that water in whenever we're ready to after insertion. But right now, we're just going to connect it there and set it aside because we're going to be using that when we're done inserting. The next what we're going to do is we are going to dispense the lubricant here so we can lubricate the tip of our catheter prior to insertion. This is really important, so this is a comfortable procedure as much as it can be for your patient. So we're going to take that and we're going to just put it in here and discard this. Then we are going to remove the catheter very carefully from this plastic sheathing. And you definitely want to let it coil like that, because if you just pull this thing out, it's going to go flying off your sterile field and then you're going to have to start all over. So for females, we want to lubricate at least 2 inches of this tip. So we're going to put it in there. Okay, so we've prepped everything that we need. Now next up, we here in a moment are going to clean the area prior to insertion. But also in some kits, you have a urine sample collection cup if you needed that, with some labeling, and then you have your drainage bag. You always want to make sure your kit came with the drainage bag, because if not, you would need that. Now we're going to prep the site before we actually insert the Foley with those betadine swabs that we just prepped. So in order to do this, we are going to take our non-dominant hand and we're going to warn the patient that we're going to be spreading the labia. And once this hand goes here to spread the labia, it must stay here the whole time because it's no longer sterile until we're done inserting. So we've told the patient, and we're going to really spread the labia minora because that is where we are going. Again, this is a stiff mannequin. These labia do not spread like they would normally. So we're going to take our first swab and we're going to go to that labia furthest away. We're going to go from top to bottom, and then we're going to discard this. Then we're going to take our next swab and we're going to go to the labia that is closest to us and go from top to bottom, then discard that. Then we're going to take our last swab and we're going to go in the middle. So we're going to go from top to bottom, really concentrate on that meatus, and then discard. Now before you actually go to insert the Foley, you want to tell the patient to concentrate on their breathing. So tell them to slowly breathe in and out and to bear down, because with that breathing, it's going to help relax that urethra along with bearing down, which is what we want. So the patient is breathing in and out. Whenever I hear an exhale, that is when I'm going to insert into the urethra, and I'm going to go about 2 to 3 inches until I see urine return. And we do have urine return in our tubing. So now that we have urine return, we're going to insert another 2 inches since we are inserting on a female, just to make sure that that is nice and in the bladder. So we have done that. Now we need to instill water in the balloon. So I'm going to have to take my dominant hand to actually push on that plunger to get that balloon inflated. But this catheter cannot be left to itself because the bladder or the urethra could contract the Foley out and we'd have to start all over. So now that we're done inserting, we are going to take this non-dominant hand and it's going to just hold our catheter like this while we actually inflate our balloon. So I'm going to take my dominant hand and I'm going to depress this plunger. As I am instilling the water in the balloon, it should be very easy. The patient shouldn't be complaining of any pain or anything like that. And if they do complain of pain, you may be in the urethra, so you may have to advance the catheter a little bit more. Now I have inflated the balloon. I'm going to let go. It should stay in place, and I'm just going to detach this and discard. Then what I want to do is I want to gently tug on this and make sure I have a little bit of resistance, because that tells me that balloon is where it's supposed to be. It's right above that bladder neck, setting nice and firmly. So now that we have done that, what we want to do is we want to clean up the patient and get them covered up, and then we're going to secure the device. So we're just going to take this off, and then we are going to discard all of this per our facility's protocol. We're going to cover up our patient. And we're going to keep the thigh exposed because that is where we're going to secure the device. So here's the actual device itself. This is going to go on the inner thigh of the female. And then there's a skin protectant pad, which is going to be applied prior to actually putting it on. So let's put it on. So the first step of what you want to do before you place this on the patient is that you want to put this actual catheter in the retainer, because we don't want to put this on the patient's skin and then clamp it shut. It's not going to feel too good to the patient. So we have the arrow. See this arrow here? It's pointing towards the insertion site. That is where we want to go. So we have the arrow pointing. We're going to take the bifurcation of the catheter, and there's this little part right here hanging off this white part. It's going to just set in between this catheter right here, see, like that, it's right there. And then we're going to close it shut by pressing these little lines right here. We're not going to press in the middle, we're going to press those lines, and it's nice and in place. Now we want to find a spot to put our stat lock. So make sure the patient's leg is completely extended, and we're going to go on the inner thigh of the female, and we want to go about right here. But we want some slack in this catheter line. We don't want too much or too little. So according to the manufacturer, they say pick your spot and then go back about an inch, and that is about where you want to go. So you want to keep note of this because this is the area you're going to clean. We're going to clean this whole area with alcohol prep and then with skin prep. So I'm going to put my fingers here just to remind me. I'm taking my alcohol prep and I'm cleaning this area. I'm going to clean an area that's even bigger than that stat lock device. We want to remove any dirt and grime that is on this skin. And then we're going to let that dry completely. Now that that has dried completely, I'm going to take the skin prep and I'm going to clean that whole area again. But this is just protectant to protect the patient's skin because these stat locks stay on the skin for a while, especially if they're going to be having an indwelling catheter. And you want to change these stat locks out according to your facility's protocol. It's usually about every 7 days. And while you're waiting for your site to dry, you want to put your initials and the date for when you inserted this so the person behind you will know when to change this out. Now that it is dry, we're ready to place the stat lock on the skin. So to do that, we are going to pull back one side of the adhesive and just place that on the skin, rub that down. Then we're going to pull the other back off, put that on the skin, and then just put it down. And again, confirm your arrow is pointing towards the insertion site. Now that we've done that, we want to position the drainage bag. There's 2 things we want to remember about this drainage bag and tubing. First thing is that this bag needs to be kept below the patient's bladder at all times, never on the floor, and never position it on the part of the bed that's a movable part because we don't want that catheter to come out. Plus, this tubing doesn't need to have any kinks or loops in it. It really needs to be a straight line, and we want to make sure we position the bag so it does have a straight line so gravity can easily drain that urine. So we will put this drainage bag at the foot of the bed on a designated hanging spot where it should go, and we're going to use this part. This is called a sheet clip. We will connect this to the sheet some spot to help keep the tubing in that straight line. And then once you get that taken care of, you can take the stickers that came with your tray, put them wherever your facility wants you to put them. Once we have all of that done, we're going to finish cleaning up our supplies, make our patient comfortable, doff our gloves, perform hand hygiene, and then we are going to document.